welcome to our very first Education Connections of the 2021-22 school year. I'm Juliette Buder, the Executive Director of the Bellevue Schools Foundation, and I'm thrilled to bring you this program tonight. We'll be discussing the Mental Health Assistance Team and the Signs of Suicide program. We'll be digging into the data behind the stigmas that can sometimes be associated with mental health. So I am, with no further ado, going to introduce our panelists for the evening. Lane Barker received her educational specialist degree in school psychology at Eastern Washington University. Lane is a mental health assistance team counselor, and this year also serves as the coordinator of the Signs of Suicide program. Lane is a school psychologist and has worked in the Bellevue School District for about 10 years. Her other job is being a wife and a mom of 2 young kids. Lane is passionate and advocates for improving school mental health systems and services for students. Corinne Bowen received her master's in social work, school counseling certification, and administrative credential from California State University in Fresno. Corinne's worked as a secondary school counselor for 19 years before becoming the director of counseling for BSD. In this position, Corinne supervises K-12 counselors, social workers, and the MHAT team. As an educator and leader, she strives daily for her actions to reflect her core values of service, excellence, and compassion. Corinne's recently moved to Washington in February of 2020 from California. She currently lives in Bellevue with her husband. Jared Taylor received his master's in school psychology and doctorate in education at the University of Washington. Jared worked as a school psychologist and a behavior intervention specialist for Bellevue School District in Bellevue, Washington for 22 years before switching roles to the coordinator of behavior intervention and mental health services. In that position, Jared led the mental health assistance team, which provides evidence-based mental health services for all students in the Bellevue School District. The 4-year-old MHAT program originated from his research at UW. Jared lives in Seattle with his wife and 2 teenage daughters. So I am thrilled to bring you this program tonight. A reminder that we will have a Q&A portion at the end of the presentation. You can submit questions by sharing your thoughts in the Q&A portion of the Zoom panel, which is on the bottom in the More function. So I will turn it over to the MHAT and SOS team.
All right, thank you so much, Juliette. Really appreciate that. Sharon, do you want to screen share our PowerPoint presentation and then we can begin?
Yes, I'd be happy to do so.
Thank you so very much. As Jared is getting our PowerPoint presentation up, I just want to say that we are extremely excited to be here tonight to talk with you guys about, you know, MHAT and the signs of suicide, which the 3 of us are extremely passionate about and would love to share with you the information that we have in terms of where we are at. Jared, if you'd like, can you go ahead and go to the next slide, please? Perfect. So today's agenda is we are going to spend some time sharing with you what the mental health assistance team looks like, who makes up the MHAT team, and then we're also going to spend some time talking with you about the signs of suicide. We are also going to be sharing the screening and BIMAS-2 data with you. We're going to share past data from last year, but we're also going to share some really exciting data this year that we already have since school started. So that will happen. We will also be talking a little bit about how we weathered the COVID storm last year, you know, being able to continue to pivot during that time and providing mental health services for students, even though school was not in person. We also will be spending some time talking with you about the expansion for this year that we're so excited about, and just sharing that piece with you, and then also talking with you about what we're looking at for the future. Next slide, please. All right. We are extremely thankful for this partnership with BSF. Without BSF, we wouldn't be able to do what we're doing. It all started with, you know, the BSF initiative back in 2015. So this slide here just shows a little bit of the information in terms of how much support we have gotten from BSF to start this initiative. So this year, out of the $800,000 that BSF is pouring into our students and our educators, we are receiving 150,000 of those fundings for the MHAT and SOS for this school year. And it altogether, since 2015, we have received $687,000. So it really is a partnership that is definitely has blossomed into something so beautiful that we would love to share with you today. So I will hand it over to Jared for the next slide.
All right. Thank you, Corinne. Appreciate the introduction. Juliet, thank you very much. I'm really excited to be here to talk about this. And as Corinne and Lane know, I can talk about this for hours, so I will do my best to stay within our time bounds. I'm always happy to talk about this. So I want to briefly introduce the mental health assistance team, kind of the framework. And it's a research-based framework that started probably 3 or 4 years ago in the Bellevue School District. I've been working on it for longer, about 6 or 7 years as well. And really the idea behind it is that we have 3 main goals, is that we want to increase identification of students with the mental health needs. We also want to increase access to counseling, and we want to increase the positive outcomes for those students by using evidence-based practices as well. A critical component to this is to try and use school-based or employed mental health providers. We will always need partnerships with our outside community mental health agencies, and we also need more people in schools. And so there's some definite benefits to having school-based employees. The framework also really tries to create better structures in districts to provide services to students. It really takes a look at implementation science and the research around that. We also want to increase sustainability, and that's really important, that we don't want this to be kind of a flash in the pan. And we do that through quite a bit of professional development for the team, consultation. We have partnerships with a variety of different agencies, University of Washington in particular, Harborview, Evidence-Based Treatment Centers of Seattle, and a few others. And we do that on a regular basis. We meet with them. We provide coaching to our staff, and then also do supervision. And as I mentioned, it's based on quite a bit of research. So what is the MHAT team, or what is the MHAT? Right now, it includes about 18 people. It's a team of highly qualified Bellevue School District staff. They're school psychologists, counselors, and social workers. Right now, we are supporting the delivery of the Signs of Suicide lesson, which Lane is going to talk a bit more about. In addition to that, we also conduct large-scale BIMAS-2 screening for students. And BIMAS-2 has a wide variety of questions, about 34 items. It's a self-report for most of our students. We use that information to identify students that we can offer support services to. And those services look like one-on-one counseling. We also, on the BIMAS-2, there is a question about self-harm. And we meet with every one of those students that identify report having thought about self-harm. And they're automatically qualified for offered services if they're interested for that. The services are voluntary, just to let you know. We use the BIMAS data, as I said, to kind of look at which students to offer those services. And we provide evidence-based mental health services, including group and individual counseling and short-term solution-focused counseling. Sometimes our support services are, generally 12 to 15 weeks. And so sometimes that may not be enough for students, or students want more confidential services, not to be seeing counselor through schools. So we do also provide support for getting services outside of the school, or if students have more significant needs that require further, like a 504 plan or special education, we can help with that, as well as working with psychiatrists out in the community. And I'll hand it off to Lane. She's going to talk about SOS.
Lane, you're muted.
Sorry about that. Yeah, I'm happy to be here. Sorry about the Zoom. It's not our usual thing, so thanks for bearing with me. Yeah, I'm here to talk about our Signs of Suicide program and how it kind of is integrated with our mental health assistance team. I kind of live in both worlds because I'm a mental health assistance team counselor at Tillicum, but I'm also coordinating the implementation of this Signs of Suicide program in the district this year. Signs of Suicide is a universal program, a curriculum that teaches all students what to do if they're concerned about themselves or a friend. In this school year, all students from 7th to 10th grades will have an opportunity to receive this Signs of Suicide lesson. In many cases, that's through their science class, and in some cases, that's through health. And in some cases, that's being offered in a separate lesson that will be supported by our mental health assistance team counselors. What the things that make up Signs of Suicide are students watch age-appropriate videos and have guided discussion around how to notice warning signs if they're concerned about themselves or a friend, and how to access support if they need it. It really is kind of a training program to give kids the skills that they need to be able to access support and to not hold a secret for a friend. Following the lesson in science classes or in other classes, we offer the BIMAS 2 screening, which is a well-being screening that's widely used across the United States that allows students to self-report how they're feeling, like Jared reported. It looks at academic, behavioral, social, emotional factors, at kind of just a wide swath of what it's like to be a kid. And it gives us an idea specifically about how students are doing with their current mental health. And those two things together help us identify students who need support and then offer services to those who do need it. Annually, that this data is probably a little bit old, but 1.5 million students across the country are trained annually in this curriculum. It's evidence-based. This curriculum has some research behind it that shows that it does increase help-seeking behavior and reduces reported suicide attempts in students. So we really feel it's a great thing for us to be doing as a school system. We have a vested interest in ensuring that our students are trained to support each other and notice when things are not right. Notice when someone's struggling. So I just want to take you guys very quickly through what the primary focus of Signs of Suicide is. There's a training available that we'll provide after this too that parents can take that shows how you support your kid to support a friend, or how you support another child in your world. So the first step that we teach students is acknowledge that you're seeing signs of suicide, right? Noticing major changes in behavior, sleeping more or sleeping less, seeming down or helpless or hopeless, increased anger or agitation, withdrawal from family and friends, and obviously talking about suicide are clear warning signs that something might be up. And so we teach kids pretty much these same warning signs, that if you're noticing things in a friend, you need to acknowledge that this isn't just something to let blow over. You should see these signs as concerning. You go to the next slide for me, Jared. Thank you. The next step is care. Acknowledge care. So that's the C in our ACT acronym. Care is just leaning into the situation, showing your friend that you care, explaining that you're not going to leave them alone, that you're going to help them, and helping them to seek support as well and accept support. And then the last step is tell. So ACT. The last step is the most important part that we try to impress upon our students, is that they need to tell a trusted adult in their lives. And that can be a school counselor at school, that can be a teacher, that can be a parent, and that can be the National Suicide Prevention Lifeline or the crisis text line. We provide kids with these resources so that they know that if they are worried about a friend, they can access support. All staff in our buildings received a training on Acknowledge, Care, Tell as well at the beginning of the school year as part of our suicide prevention efforts, so that all of our staff are speaking the same language as our students too. This Acknowledge, Care, Tell, we're really knitting it into the fabric of what we do as a school so that we are sure that we're all speaking the same language, and that when a kid takes these steps, does their Acknowledge, Care, Tell, we are ready to listen.
I think I'll talk about the COVID related concerns, but I did also want to kind of tag on a little bit with what Lane said is, I appreciate that we've been doing this with staff as well, and we're obviously trying to put more out there into the community for parents, and we're really trying to normalize talking about suicide as well. I think that's really important about this. So I'm going to talk a little bit about what happened last year and how we kind of shifted. We did work with 7th graders and 10th graders last year with the SOS, and the MHAT was at 10th grade last year. And some of the issues that we saw, the counselors and Lane in particular saw a lot of these things working with students, is that certainly was an increase in dysfunctional sleep, eating, exercise schedules, kind of kids' schedules were just completely off. A lot of kids felt invisible and lonely. It's, when you're not seeing anybody, or unless it's online, and even then, a lot of students wouldn't turn on their cameras, so it was hard to be seen as a human being in that situation. Unfortunately, a lot of our students relied on online relationships for social interaction, and most of them are good, but sometimes they're not always great. They don't always encourage safety and health. Certainly, there was a higher exposure to suicidality, violence, and other kind of unsettling content as well, so that kind of increased sensitivity of students. Students did share with us significant anxiety and stress about contracting COVID themselves, and particularly affecting their loved ones, grandparents in particular. A lot of students expressed concerns about grandparents. In addition, there was a lot more family strife. I think we've heard in the community that issues of emotional abuse and domestic violence certainly were higher. I think that's something that kids have reported to our counselors. In addition, online bullying and sexual harassment was pretty high level. And these are things that it's easy to do when for students when they're kind of hidden a little bit behind social media or other things like that. So those were the things that we're kind of dealing with, the repercussions of those challenges this year. Last year, we had done quite a bit of planning during the 2019-2020 school year with pivoting to virtual. And so all of our screenings last year and our counseling sessions and the SOS were virtual. So our health department, Troy Markham is our health curriculum developer, modified the SOS curriculum, and so we were able to deliver that online. A couple of classes supplemented the curriculum with people from Crisis Connections, which is a great organization that supports students around suicide and other crises. We also expanded, previously it was just at the high schools, the comprehensive high schools, but we implemented at the 2 choice schools, Big Picture and International. About 20 students or 20 teachers, provided that lesson across all grades, and about 2,570 students received the SOS lesson. So there's a little bit of a breakdown here. You can see kind of a steady increase from the year before, so almost double of from 653 to 1,250 before. We did do, we do an exit ticket after the lesson that asks the students if they want to talk to somebody about a student, another student, or themselves, to kind of piggyback on the acknowledge, care, tell aspect, the tell aspect. About 72 students wanted to talk to them versus 62 the previous year, so a little bit increase. Most were false positives. Students wanted to talk about some other issue than suicide, but we see that as not a bad thing. It's good to get to know your school counselor and be able to talk to that. 10th grade, about 22 students participated in the SOS lesson, and on the next slide, I'll kind of talk about those results. So pretty high number of students, 40%, so 529 of that 1322 report symptoms of anxiety and depression ranging from kind of mild, moderate to more severe. Pretty significant number. And of that number, 231 10th graders indicated thoughts of self-harm. In the biomass, there's a question about that, and we follow up with every one of those students. So the 231 students met with a MHAT counselor or school counselor to kind of find out further information about that. And kind of from those interviews, 87 were not an imminent risk, but did require some additional assistance from the counselor. That might be some basic education about mental health, some relaxation strategies, assistance around working with peers or things like that. We ended up creating about 8 safety plans where students were high risk. So those are safety plans are plans that take into account resiliency factors of the students, identify some coping mechanisms, and provide people to talk to as well. One thing I'm also really proud about is that we also offered a resiliency class district-wide to both high school and middle school students. We're going to try and continue that again this year. That was a well received and positive. Of the 529 students that reported symptoms of anxiety and depression, the MHAT counselors worked with 110, and they received cognitive behavioral therapy plus services from those. And what we found is that about 88% of the students that received the CBT counseling services described increased coping skills. The MHAT counselors did a variety of other things. They did some group counseling and then also supported many students using kind of brief counseling or solution-focused counseling. So some takeaways from last year is that what we found is fewer students attended the SOS. As with every class, a lot of students would either log in and then not attend or not participate, or they just wouldn't show up. So I think some of our numbers were down because of that. And so we had fewer number of students completing the survey. Quite a few students were disengaged in the online learning. We did try to make up for that. So we did offer multiple attempts to meet with students and offer the services. There's a certain populations where we were really much lower, and so we did make up screenings for those. And we worked with like case managers and counselors to try and help students take the survey. And if I haven't mentioned already, the survey is completely optional. Students are not required to take that, and we make that clear with students to start. And then the next takeaway is that we found that the virtual services worked pretty well. We were a little bit surprised by that, but it actually worked quite well. Obviously, we found that kids that struggle with in-person attendance actually benefited from the virtual services quite well. And it was nice, it was easy to shift because we had, the issues of the pandemic. We were able to address those pretty easily because we had the MHAT SOS services in place before the pandemic hit. So it was a lot of work, but it was also a relatively easy shift as well. We learned a lot from that, and we are definitely preserving some of the virtual learning benefits. I think we're going to provide some services online. We are also working with the virtual school as well this year. I think of what else. I think I talked about greater access. So the virtual services are allowed for greater access. Talked about the resiliency class, and then I just really want to thank the team and the district that it was kind of a hard situation, but the team made it happen. They did a great job. I'll hand it over to Chris.
All right. Thank you so much, Jared. I just want to take a moment and kind of highlight for everybody here today on the call, just the difference from last year to this year that we have made. And we're super, like I said, excited about the MHAT expansion. So as Jared mentioned earlier, last year, we provided the SOS lesson to all of our 7th and 10th graders in the health class. So in order for us to expand it, we had to remove it from health and embed it into the science classes instead. And so now this year, we are offering the SOS lesson to all of our 7th, 8th, 9th, and 10th graders. As Jared mentioned earlier, last year we had 5.5 MHAT staff. This year we've grown to 18. Pretty awesome team and a very powerful, I say it's the dream team. Doing a lot of great things for our students in the district. Last year, Jared kindly agreed to take on the added responsibility of being the SOS coordinator as well as the MHAT lead and MHAT coordinator. This year, we have Lane, who has, we've dedicated a 0.5 of her FTE to be able to do that work. And then also for her to continue to provide direct services to students at Tillicum. This part right here, this next one is something we're really excited about. In the past, we've only provided the SOS training to those individuals that were going to be teaching the lesson. This year, we decided, if we're going to make this and normalize this, everybody needs to be speaking the same language of the ACT that Lane took us through. So that includes everybody in the Bellevue School District. So all staff receive basic SOS training, and those that are teaching the lesson receive an additional training for the SOS lesson, for delivering the SOS lesson. We are also very intentional this year too, knowing that, the partnership with parents and families is an important part of all of this. So in the past, parents had access to the SOS parent portal. This year, we're, like I said, being very intentional and doing these types of things, presentations, but also just recently we did a community forum on helping your child save a life. And that presentation, by the way, I believe the link will be shared with you. It's recorded, so you certainly can watch that. And it's our superstar Lane who is recording that video for all of you. So you have access to both. And then also the last year, MHAT services were only offered to our 10th graders because of the expansion of more MHAT counselors. We're now able to offer services to all of our 7th through 11th graders. Although our 11th graders may not get the SOS lesson because they received it last year as a 10th grader, we are going to do the BIMAS screening with them in the spring and offer services if they need it. So we're super excited about that piece. And the next one is, we didn't have any MHAT counselors at the middle school. This year, we have an MHAT, at least one MHAT counselor at every single middle school. And then and the choice school as well. So we're really thrilled with that. And then we were able to expand and add an additional MHAT counselor to each of the comprehensive high schools. So just, the expansion itself, we're hoping that the data, which Jared's going to share a little bit, it's, we're not completely done yet with the whole screening and BIMAS too, but we are going to share with you at least the preliminary data. And it's very positive and from my point of view of all the work that this team has already done. All right, Jared, I believe you're on next.
Yeah, I'm happy to talk about this. It's also sobering data. It's hard to look at, but also it's important to take a look at. So we're right now in the SOS lesson and BIMAS 2 phase, where we have one more week, approximately one more week of screening at the middle school level. Then we'll start with our choice schools. First, before I go any further, I really want to appreciate a lot of people that have worked on this to make this happen this year. We've had Tori Markham and Wendy Powell, Scott Powers, Eric Ferguson, all of our science teachers at the middle and high school level, all of our middle school counselors, high school counselors have really worked hard on this. And it's been a big lift for a lot of people. So I want to make sure that we acknowledge the people that deserve it. With that said, we've screened as of this morning, 3,799 students so far. And 776 students reported thoughts of self-harm on the BIMAS 2. So we have met with every single one of those students. It's been a huge lift, and it's been important that we do. We created 78 safety plans from that, and unfortunately, 7 students went to the hospital for their evaluation. I think that's also another sobering statistic there. If you want to break it down by middle school and high school, you can see some of the numbers. I think Lane mentioned this a little bit earlier. The BIMAS 2 looks at 5 different areas. The ones that we focus more on are the conduct area, negative affect, cognitive attention, and self-harm is the one that's also in there. And you can see kind of the breakdown between each level as well. Negative affect is down a little bit from the previous year, which is good news. I don't know if that's statistically significant or just variation. I don't know. Our self-harm ideation has hovered consistently when we've done this around 20%. So 1 in 5 students have indicated that. A lot of them are false positives, meaning that they didn't either understand the question or they mismarked it, or it was not a significant concern. But as you can see, 78 students out of that, so about 10% of the students that reported on that it was significant, and a wide number of more. They did actually think about self-harm, but it didn't require a safety plan. So I'll let Lane talk next.
Yeah, and just to clarify on those data too, we're still working in the middle schools. So those numbers will come up significantly over the course of the next week and a half, because we still have a significant number of middle school students to screen and work with.
Yeah, we're about halfway through middle school.
Yeah. So I just want to share that this sort of the personal side of this, right? The data is incredibly important to us, but how this program impacts individuals is equally important. If this program and effort saves a few student lives, then we've done our work, and all of it was worth it for us. And so parents, when you hear from us and you send us these wonderful letters back, you have no idea how much they mean to us and how much we appreciate them. This letter on the screen was a letter from a parent received after checking in with a student. And I guess, I can read parts of it, but yeah, this parent just shared, "Thanks so much for this communication. I think it's amazing. It really demonstrates an exemplary level of care and commitment to students and families, and it means a lot to me as a parent." And this parent shares some really amazing strengths of their child, and just shares some gratitude that this program is here for our students. I can safely say, as somebody who's been doing this work in schools for the last few years, and helped create this mental health assistance team program and has been coordinating the delivery of the SOS, that I really do believe it's impacting students positively. It is helping us to find students that we didn't know about, right? We have found students through this process who have shared with us many times that they never would have told anybody they were struggling. And that means so much to us, that kids are feeling comfortable coming forward, sharing and accessing support through their school, a place where many kids feel more comfortable and feel like they can trust the staff. Having MHAT counselors in the building has been pretty amazing too. We have had several crisis situations come up this year as part of the screening and not as part of the screening that our folks were able to respond to quickly. And we are quite certain that a couple of our superheroes have saved lives this year and saved some of our students from some pretty significant consequences. So I know I'm very grateful to be able to do this work in the schools, and very grateful that we have the opportunity to do so, because the district and BSF have committed the funds to make it happen.
Definitely. I do want to highlight something also you said, Lane, is that what's been good about using the screening tool is that we are identifying students that would normally not be identified. Our early warning indicator data, which are grades, attendance, and discipline, which is often used to identify students in need. About 25% of our students that we found out through the negative affect scale, or anxiety and depression, did not have any issues with grades or discipline or anything like that. So they're silently suffering. And as a student who did well in school, and had some mental health challenges, it's great that we're identifying some of those students as well.
I'm very proud. I like to think that we're kind of opening the door for students, and for those who choose to walk, some of those kids who choose to walk through that door, we may not have known otherwise with this had we not opened that door.
Yep.
Yeah.
All right. And I think this is Grant's.
Yes. So I am going to share a little bit about our vision moving forward in terms of what this is going to look like for the future. We currently do have 0.8 FTE devoted to elementary schools, but this year we really are going to use that to do sort of more needs assessment, talking with our elementary counselors to see what the need is at the elementary level, and then working on a plan for next year. We see the MHAT services for elementary school to be more of a consultation model versus direct service model. So that's something we're going to be working on. So more to come on that, and we will be sharing as that unfolds. We really are going to work on trying to deliver the SOS lesson and provide the BIMAS 2 as well to 6-12. Right now it's 7 through 11, and we really want that. That's our ultimate goal, is to be able to offer this across the district for our secondary students 6 through 12. The other thing I just wanted to point out too is that our SOS lesson will, once we fully implement this and all of our students throughout the district have the opportunity to get the SOS lesson every other year, those that have already received it will receive a refresher. So that way they're not getting the same curriculum and the same lesson over and over. So that is something that we have thought about. I had mentioned this piece earlier. We know that the family engagement, the piece with involving parents is huge in this all of this process with suicide prevention. So we are being very, very intentional and want to do our best as a team to make sure that we pull our parents in however we can and educate our parents, provide information, let you guys know what's going on, what we're doing with the students, with your students in school, and hopefully answer any of those types of questions that you might have. And then, I just want to take a moment. I know we're going to be ending here soon, but we definitely couldn't have started this without the support of the Bellevue Schools Foundation and the donors for making it happen. So we truly are so thankful because here we are now, right? And we know that SOS and MHAT together it's effective. Jared shared that 88% of the students that receive MHAT services, express that they have increased in their coping skills. And of course, we're going to continue to work with our partner agencies because we know a lot of our kids are suffering and need support. And, we only have 18 individuals servicing the entire district. So we know that we're going to depend on our partner agencies to refer out as well. So that is something we definitely are working on too. And then Jared and Lane over the summer have been working on a manual for just the MHAT framework. And if, we know that if it's working here in Bellevue and if other districts are interested in wanting to start something like this, we would be more than happy to share. So I don't know if Jared or Lane want to say anything about the manual and that piece of it. I'd welcome any comments that you guys have.
Yeah, it's close. The screening process has taken over every aspect of our lives right now. I think Lane would definitely likely agree, I would assume. But once we get done with that, we'll finalize it, and it'll be a publicly available document. It's not something that we're, it's not something that we're keeping internally.
And Jared, do you want to share some opportunities that you have already had, the team's already had to present, like at national conferences and that type of thing in terms of the MHAT framework?
Sure.
Nice
sure.
to work with folks on this.
Yeah, we have talked with other school districts like Washington, Seattle, Richland, a few others. Those are the primary ones. We've done a presentation at the Advancing School Mental Health Conference, which is based out of Baltimore. We've done the state social worker conference, school social worker conference, and then we're doing the National School Social Work Conference this fall. We also have applied to the National Association of School Psychologists, and I don't think we've heard back at this point. So we're really trying to make sure that the things that we learn that we share with others to be able to help, kids across the country.
Okay, thank you for that. Next slide, please. So here's our contact information. So feel free to reach out if you have any questions. We are also, Alyssa Symes is not here today, but she is definitely a big part of our MHAT lead and our MHAT leadership. But the three of us are here. So if you have any questions, feel free to reach out. Next slide, Jared. And here is where all of our MHAT staff are at, which school, and in terms of their part-time, full-time, that's all here for you as well. And we are going to share this slide deck. I know that was, I think, one of the questions that are in the Q&A. So I'll let Juliet or Jared maybe perhaps address that in a bit in terms of how to access that. Next slide, Jared. And we want to say thank you to BSF for this wonderful opportunity to invite us to come and present information to all of you. And we, like I keep saying, we wouldn't have been able to do this without this partnership that we have. So we're truly thankful. And we hope that we'll continue to do, you know, this partnership so that we can do great things for our students in the school district. All right, I think that's it, Juliet. I think we're opening up for questions.
Fabulous. Well, the gratitude is definitely coming from our direction to you all. And thank you again, Lane, Chris, and Jared, for the incredible work you have done for our community and for sharing this data with us. On behalf of the Bellevue Schools Foundation, we are so proud to be investing in this work and your expertise. So I have collected our questions. So we have about 100 people with us right now, and I will kick it off with a question around credentials. So what certification and credentials do MHAT counselors have? And there was an SOS class mentioned that is embedded into the science curriculum. What MHAT counselors teach this class, or what's different than regular science teachers?
Well, I could speak a little bit to the credentialing of the staff. So all of our staff are either psychologists, counselor, or social workers. So they have minimum of master's degree and have an educational staff associate certificate. Part of the model is to provide extensive training to our staff. What we found, what I looked at in the research, is that outside clinicians through community mental health agencies tend to be better trained than school staff around counseling and therapy, things like that. But school staff are better embedded in the schools. They have better connections, better communication channels. They know schools really well. And so my goal was really to try and combine those two strengths. And so we provide quite a bit of training through UW. Our primary tool that we use is Cognitive Behavioral Therapy Plus, which is a modularized form of CBT. I can talk for a lot of that. If you have more questions, Lane can too. It's a great tool. We've had quite a bit of training from University of Washington and Harborview around that. There's a consortium across the state around CBT Plus, and a lot of the community mental health agencies, or most of them actually, have had that training as well. We get weekly consultation from them for the staff. In addition, we provide consultation amongst ourselves. We've had training in motivational interviewing, as well as behavior activation, trauma-focused cognitive behavioral therapy. We're doing some groups this year, our cognitive behavioral interventions for trauma in schools, or CBITS. Quite a few other trainings, and that's a big focus on this process. Lane, did you want to add anything? Or
yeah, I would just say that just to piggyback on that, I would say it's a real strength of our staff that we are from multiple disciplines. Some of us are school psychologists like me, right? Some of us are social workers, and some of us are school counselors. And so that variety of graduate training really adds to the strength of our team, I think, because we see things from multiple perspectives. And yeah, I can safely say as an MHAT counselor, I have received extensive training in providing mental health interventions for students, and that is ongoing, right? It's a huge part of our model, is ensuring that our counseling providers receive significant training and that it's ongoing throughout our process.
Yeah, I would like to also add to that is that in the research that I did, training was a huge indicator, obviously, of implementation of CBT in particular. And so the technical assistance team model, which the MHAT is based off of, really embeds that in. And so, I'm very appreciative of the leadership of the Bellevue School District in recognizing the importance of that and offering those opportunities for us as well.
Mm-hmm. And then the second part of the question, I think, had to do with the delivery of the Signs of Suicide program in science classes specifically. Delivery of Signs of Suicide is a curriculum that's designed to be delivered by any educator. It provides the structure and content necessary for any teacher to teach it. We have trained all of our providers in district, all of our teachers to provide the SOS lesson who provided it this year. Not every teacher is trained in providing the lesson, but all the teachers who delivered it this year received in-district training on the lesson itself. And so it was it's being delivered and has been delivered by science teachers, by mental health assistance team counselors, and by school counselors over the past several years. It also has been delivered by health teachers for several years in the district. And it varies by school and by individual classroom, which provider delivered the lesson. So I couldn't speak specifically to it's a number of different people may have delivered the lesson within, say, your child's class. We also provide support within the classroom when we're providing the lesson. So one of our staff is teaching, and there's always another counselor in the room to support in case a student is triggered by the content of the lesson, as it can be, hearing this material can be really triggering for students and staff. And so we provide mental health support by having a counselor or an MHAT counselor in the classroom while the lesson is being taught.
And I would probably add to Lane that the reason why we had to move it out of health is because health is only offered in 7th and 10th grade, and it's only offered every semester. So in order for us to do this expansion, we needed to embed the SOS curriculum, the lesson, along with the BIMAS 2 in another content area. So it could be anything. It could have been English, it could have been math, but it was science, and that's where we're at this year with it. If we're going to be able to continue to expand and ultimately make it a 612 opportunity for our students in the Bellevue School District.
Great. We have an attendee who has a 6th grader who is in need of mental health services. The question is, will the need for service remain confidential, and who should she contact?
Yes, the services are confidential. And right now we're not offering services to 6th graders, unfortunately, at this point. But that doesn't mean that MHAT counselor can't be supportive or helping define those services. I think if parents have concerns about their kids, the first person to go to is a school counselor. The MHAT services are not kind of widespread available to every student, whereas services from school counselors are. And the school counselors will kind of know what's been happening with the student and what's going on, or likely would know, and then can determine if MHAT services are appropriate. Some of the things that MHAT service counselors are good at doing, though, is working with community agencies, trying to help find services and get kids hooked up with that. So
can I also to add, Jared, that we have Colleen Kent, who is our YES Youth Eastside Services behavioral health specialist that is at the middle school. So because we know there is this gap in service in terms of MHAT, offering services to our 7th and 8th graders, so she will pick up the 6th graders. So if there is a need for counseling services, it's still short term. It's, if a student is really impacted and needs more intense services, she will still also need to refer out. But if it's if a situation where a student just needs maybe 12, 15 sessions, just brief, then she will be able to work with your student. So, but just like Jared said, the first place to start is to talk with the school counselor, and then the school counselor can refer your student to Colleen Kent. Like I said, we contract with YES to have 3. We've renamed them a little bit. We've restructured it a little bit, but for the middle school, her title is still a behavioral health specialist. So I hope that answers the question there. I don't know, Jared, you guys want to add additional?
Well, I want to make sure that you know that we're not out there to exclude kids completely, and we do want to help whatever capacity that we can. Part of the challenge, the reason why we chose 7th through 11th is just capacity. As you know, you saw the needs, 700 and something students, and that's a large number of people, of students that need help. And my hope, part of MHAT also is not just direct service. It is really to kind of look at what we're doing as a district to expand services even beyond that. So, what are existing mental health providers in the district doing, and how can we free up more time for them to see students around mental health? And that's kind of down the road. I think we've been gifted with some money from the COVID recovery funds to be able to hire this 13 new people. But I also think that even that number is not enough. And so my hope is in the future that we can do more. But yeah, I want to make sure that, that you do, I'm happy to help as well. So if you have specific questions, I can help out too.
Yeah, supportive referral is a huge part of what counselors can do and what our mental health assistance team counselors can do. So anyone, right, if you have mental health concerns for your child, the school can be one of the best places to start to figure out how you're going to access supports, whether that's through MHAT or through community mental health or through a private provider. We can definitely support families to try to help you get connected. Right now, that can be very challenging, and we know the need for mental health services is huge right now in our community nationwide. And there's a massive shortage in providers. And so we are doing everything we can to make sure families get connected to resources and trying to keep up to date on what those resources are and what's available to you.
Thank you. So we have a question around whether the success of the Signs of Suicide program is going to be potentially translated into a Signs of Depression program. The question is around whether the proactive approach would benefit students in terms of their discussions of feelings around anxiety and depression in the same way that the Signs of Suicide program functions. And this attendee also would love to hear your recommendations about resources and provide next steps and suggestions for students struggling with depression.
Mm-hmm. Yeah, the existing Signs of Suicide program does talk a lot about depression and how tied it is to suicidal ideation, right? Like being depressed doesn't necessarily indicate that a person is suicidal, but many people who are suicidal have a mental health condition, and that mental health condition is often depression. And so the program is definitely geared to support students in noticing signs of depression, and specifically talks about that. Not just about signs of suicide itself. And a huge goal of it is to destigmatize talking about mental health. Is it going to expand to becoming a broader discussion about a variety of mental health conditions? I don't know. That remains to be seen, I think. But I think this is one big step that we can take to ensure that we're talking about suicide and depression openly with our students. And I think it's powerful that students are receiving it in a general education setting, not in this kind of siloed area, right? It's part of our school, and that teachers are talking about it, not just counselors, right? But yeah, is this program itself gonna fully destigmatize and have kids talking about anxiety and depression? I don't know. I think it is not going to hurt.
I have some thoughts I can add as well.
Please.
I will tell you my wish list at this point. And my hope is that the resiliency class that we're providing will be available to all students, or most students. Right now, it's been small, and I would love to see the work being done across the district for all levels. I know certainly at the elementary, some of the ruler in particular is one. Some of the second step work that we're doing at the elementary is really important. It's been a little harder to implement kind district-wide curriculum or school-wide curriculum at the secondary level. The state does have some social emotional learning lessons that we are doing, and there's a variety of other tools as well. My wish list, there's a resource called DBT's Skills in Schools. It's by Dr. Jim Mazza at University of Washington and his wife, Elizabeth Dexter Mazza, and a few other people. And it's a great program that I could see us eventually trying to implement. I would love to. It's a large lift as well. And I think that not sure where that would happen, but I think that's something that we need to discuss in the future to do more work around what we call tier 1, which is kind of all school support. Just to give you a little bit more context on that, it talks a lot about coping mechanisms, recognizing kind of thoughts that are challenging, talks about mindfulness, a variety of other types of strategies. It's rooted in really good research.
Thank you. So I'm noticing that we are nearing the 6 o'clock mark. Our panelists have been extremely generous so far with their time, and they have offered to stay on for a little post presentation discussion. So we are going to go a little bit past 6 p.m. But I did want to close with some kudos that were sent via the Q&A box. An attendee shared that she worked in the Bellevue School District Counseling Office for 7 years and yearned for a program such as the MHAT and SOS programs. And she's so pleased to hear of the work and would like to trumpet it more broadly. So from some of your peer counselors, there's excitement as well. So the next question is around whether you all are engaged in the current Washington State mental health crisis intervention work as they're considering new models, which is happening via committee process.
I've heard of it, but I don't believe any of us are involved in that.
Yeah, the only thing that we were, the closest thing that I can think of, and Lane popped in at the very end, was we did an interview with Puget Sound ESD, collecting information about behavioral health. And so I'm sure, I forget the gal's name, but she's collecting all the information from the different districts and then submitting it. So I don't know if that's part of this process that this attendee is referring to, potentially. But we're not directly, if the question is, but we're not currently directly working. Not unless Jared or Lane know something different.
You would know if we were doing it, yeah.
Nope, I have no time for another committee, but yeah. We're definitely doing our best as far as advocacy efforts, but no, we're not part of that.
And I would just add that during that interview, we did share a lot about what we're doing in terms of the MHAT and signs of suicide. So that did come up in the interview.
Great. So there's a question around the 8 safety plans, and if a student is in some kind of risk that's not technically high risk, why it might not be necessary to have a safety plan for them.
Yeah, I can speak to that. So that was data from a previous, not this year, but last year. And that number's come up significantly, right? We've done almost 80 safety plans this year. And part of that is because we have significantly updated and revamped our suicide intervention and safety planning process for students over the course of the last 2 school years, or last school year and this school year, including significant new training for a lot of our staff. Safety plans are required in certain instances when students are certainly at very high risk, but safety plans are something that a provider can do with a student at any time if they feel like it's needed. Part of the reason that we don't safety plan with every single student who screens in with an affirmative answer to item number 24, which asks about thoughts of self-harm, is because some of those students don't need a safety plan, right? Some of those students may share something like, who doesn't have a passing thought right? But they're at very low risk, right? They're not a student who has any, who's ever taken it farther than that, right? Who occasionally has a passing thought about self-harm or a passing thought about suicide. And so there are many students whose safety planning would not be appropriate, who screen in through this process. And then sometimes as well, safety plans happen subsequently as part of this process, as part of the MHAT process. They just aren't always necessary as part of the screening, right? These screening conversations that we have with students need to be brief, unless the concern is high, because we've met with almost 800 students individually. And so we can't, or it's not always appropriate to do a safety plan in that brief meeting, but many times additional safety plans will follow as those students become initiated with their school counselor or with mental health assistance team counselors as part of our service delivery.
So we have two technical questions. One is around whether virtual students are also being screened, and the other is about accessing the SOS parent portal.
So there, yeah, Jared.
Lane, I'll let you go. SOS.
There are plans to provide the SOS lesson and screening to our virtual students. We don't have an exact date on those yet, but we do have FTE allocated for that. And it's forthcoming. As that model has kind of shifted and changed a little bit at the beginning of this school year, we are adjusting as well to figuring out the best way to meet those students' needs and provide the SOS lesson and our screening. We have done SOS lesson and screening virtually before, so it's something we absolutely know how to do extensively. So we just need to make sure that we have a process in place that ensures that students who are at home are safe when we provide this lesson. It's a lot easier to provide it in person because the students are sitting in front of us and we're able to check in with them pretty quickly. When they're virtual, there are a lot of planning steps that our team needs to take to ensure safety. And so we are working on that plan and it's forthcoming. But yes, there's a clear, we will definitely be screening our, providing the SOS lesson and screening our virtual academy students. And then what was the other part of the question? I forgot.
It was around the parent portal.
Oh, can I post that in the chat right now, Juliet?
We can send it out to everyone following the presentation. There's going to be resources sent tomorrow, or I can share it in the Q&A.
Okay. Yeah, the parent portal for SOS has changed over the course of the last year and a half. It used to be that you needed like a login, you needed your school's login to access the parent portal. And now they've made it widely available just via the SOS parent portal link. Any parent can take the materials and what's there. I will say it's interesting. It focuses more on the high school lesson when you look at the parent portal. The middle school videos are not as easy to find on the parent portal. The ones you'll be presented with are the more mature level videos. The videos that you'll see on the parent portal, or the videos that you don't see on the parent portal presently, I've asked them to put them on there. The videos for the middle school students are significantly less personal, intentionally, right? And they're more developmentally appropriate for younger students.
One of our attendees has shared beliefs that anxiety is caused by lack of exercise, sleep, and poor time management skills. There's a request and question around whether there will be classes for kids to educate them on time management and the importance of sleep, as well as optional PE training as it relates to anxiety, depression, and this conversation.
Great question, and definitely lots of research shows that exercise and eating well and time management also certainly helps people feel more comfortable and less anxious. I don't know, this is a district-wide thing. I think our health curriculum certainly goes into those areas. Of course, it's only 7th and 10th grade. So I don't know of any other initiatives around that. Again, the resiliency class that we are hoping to expand upon does go into some of that content. I don't know, Corinne, do you know of any other initiatives that are going on?
Some of our SEL content does touch on those areas as well, delivered to students in secondary. But and the resiliency class definitely touches on those issues. Those, sleep, eating, healthy habits, and, effective time management and executive functioning skills are something that is addressed in individual counseling many times for students when those things are part of their treatment goals or what they need. So those things are addressed with individuals for sure in counseling.
One thing that the BIMAS does look at is an area called cognitive attention, which is essentially executive functioning skills, which incorporates time management, response inhibition, starting a task, staying on task, things like that. And we are going to probably share some of that information with school counselors so that if there are concerns that we can kind of look at different interventions, small group interventions, as well as large group, supports around that, see what we can do. That's kind of new this year, so we don't know exactly what that's going to look like and to what extent.
Great. Well, that is the majority of the questions, and again, I want to thank each of you for your time, your expertise, and this is time you could be working with students. So we are grateful you are sharing this insight with us, and we look forward to continuing the conversation and continuing to support this critical work. Again, I will be sharing resources from Jared, Corinth, and Lane to all of those who have attended, and they have shared their contact information today. It will be in the materials. And we are thrilled to close out our first Education Connections for the year. So again, thank you for all of you who attended. Do not hesitate to reach out to me, Jared, Corinth, or Lane if we can answer any further questions around these programs. And we look forward to sharing even more success at the end of the school year and for years to come.
Thank you, everybody. Appreciate your time. Have a good night.
Thank you.
Thank you.